If your baby is in the NICU, chances are you've heard the term IVH or brain bleed. And I know that phrase alone can be absolutely terrifying. So, this explainer is for you. We're going to walk through what it means, why it happens, and what to expect, all based on trusted medical information. Okay, let's get right into it. Hearing those words, it can just take your breath away. It is completely 100% normal to feel scared, confused, overwhelmed. You're already trying to find your footing in the NICU, and this is just another huge wave of worry. The hope here is that we can replace a little bit of that fear with some real understanding. Okay, before we go any further, I need to say this, and it is the most important thing you'll hear. This is not your fault. An intraventricular hemorrhage, or IVH, is a known complication of being born too soon. It is not something you caused. It's not a sign you did anything wrong. This is about prematurity, not about parenting. Period.
All right, so let's break it down. What exactly does the medical team mean when they say brain bleed? The specific term they're using is IVH, and getting a handle on what that stands for is the very first step.
So, at its core, IVH is bleeding that happens in a very specific, really delicate part of a preemie's developing brain. This isn't some shocking, unexpected event for the NICU team. It's actually a known risk they are constantly on the lookout for, and they often screen for it before a baby even shows a single symptom. So the big question is, why? Why does this happen to premature babies? Well, the answer really lies in all the incredible, lightning-fast development that's supposed to happen safely in the third trimester. But for these little ones, it's happening out here in the NICU instead. Probably the best way to picture it is like this. There's this one area in the brain, the germinal matrix, and in a preemie, it's basically a bustling construction zone. It is packed with brand new, super delicate blood vessels. And in a baby born really early, those tiny vessels just haven't had the time to get strong and sturdy yet. So doctors usually point to three main factors that all kind of play together. First, like we said, the blood vessels are just incredibly fragile. Second, a preemie's little body just isn't great yet at keeping blood flow to the brain perfectly even and steady. And third, all the normal stresses that come with being born early, trouble with breathing, changes in blood pressure, all of that can put pressure on that delicate system. It's why you're always hearing the team talk about keeping your baby stable. Now, this is really important. Look at the timing. IVH almost always happens very, very soon after birth. In fact, more than 90% of all cases happen within the first 3 days of life. This is exactly why the NICU team is doing those routine head ultrasounds so early on. They're looking for it right in this critical window.
And this chart just perfectly shows what the single biggest risk factor is, how early a baby is born. You can see it clear as day. The risk is way up there for the tiniest babies. About 45% of infants born before 25 weeks will have some grade of IVH. And as a baby gets closer to their due date, that risk drops pretty significantly.
Now, beyond just how early they are, other medical hurdles can raise the risk too. Things like needing help from a ventilator to breathe, having blood pressure that swings up and down, or fighting off an infection. All of that adds stress to a preemie system. And again, this just goes to show you that IVH is a medical complication, not something anyone could have prevented. Okay, so we know the team is watching for IVH, but how do they actually see it? Well, the whole diagnostic process really revolves around one key tool. The head ultrasound is really the gold standard here. And the great thing is, it's a completely safe, painless test that they can do right there at your baby's bedside. It just uses sound waves to create a picture of the brain. They use the baby's soft spot on their head, the fontanelle, kind of like a window, and it gives the doctors a really clear map of exactly what's going on inside. So once IVH is seen on the ultrasound, it's given a grade. A grade 1 is the mildest form you can have. This means the bleeding is small and it's stuck right inside that fragile construction zone we talked about, the germinal matrix. This is what they call a low-grade bleed. Grade 2 is also considered low-grade. What's happening here is that a small amount of blood has found its way into those fluid-filled spaces in the brain, the ventricles, but there's not enough of it to make them swell up or get bigger. Now, grade 3. This is where things shift, and we start talking about a severe bleed. In this case, there's a lot more blood inside the ventricles, and all that blood is actually causing the ventricles to swell and get enlarged. This is obviously a more serious finding, and the team is going to be watching it very, very closely. And then there's something you might hear the doctors call PVHI. Now, this used to be called a grade 4, but it's now understood a bit differently. This isn't just more bleeding. It's actually an injury to the brain tissue right next to the ventricle. It can happen when a really big bleed messes with the blood flow in that specific area. This is also considered a very severe and significant injury.
So after your baby gets a diagnosis, what actually happens day to day? What is the team doing, and what are they watching out for? Let's get into that.
This is probably the most crucial thing to understand right now. There is no medication that can stop the bleeding or reverse it once it's happened. Instead, all of the NICU care becomes focused on supporting the baby, keeping blood pressure stable, making breathing as easy as possible, and just preventing any more stress on their little body while it heals itself.
The number one complication the team is watching for after a severe IVH is something called PHVD. Basically, this is when the ventricles start to get bigger and bigger in the days and weeks after the bleed, because the leftover blood is getting in the way of how the brain fluid normally circulates. This is the main reason why your baby will need those follow-up head ultrasounds. And now we get to the hardest question, right? The one that's on every parent's mind. What does this actually mean for my baby's future? And just as important, what can you do now? Okay, for the low-grade bleeds, that's grades 1 and 2, the outlook is generally really good. A lot of these babies grow up to have outcomes that are pretty much the same as other preemies who never had an IVH at all. For the severe IVH, yes, there is a higher risk for future challenges. But, and this is a huge but, the outcomes vary so widely. No two babies are the same. Right now, your most powerful role is to be an informed advocate for your baby. You're a vital, crucial part of the care team. And the first step to being informed is asking good, clear questions. You can start right here. Ask them, what's the grade? Is it on one side of the brain or both? Ask if the ventricles are stable or if they're getting bigger. Find out when the next ultrasound is planned. And it's never too early to ask, what kind of developmental follow-up will my baby need after we go home? These questions will give you a much clearer picture. And I want to leave you with this last thought. All the grades, the risks, the statistics, they're really important tools for doctors to understand patterns in large groups of babies. But they do not and they cannot predict your individual child's journey. The team is focused on the baby that's right there in front of them, and that is where your focus should be too.